mind. My name is Maxwell. I'm a physical therapy student from Concordia St. Paul's. Can I work with you today?
Yes.
So I read your file. Tell me a little bit more about what's going on.
I was in this freak accident 8 weeks ago. I was shot in the leg during hunting. It was horrifying. I felt like my boot in my foot in my boot was just on fire, and I heard someone screaming, and I realized, oh my gosh, this is me screaming. And I was rushed to the hospital. I passed out, and I woke up with half a leg.
Yeah.
And it's been really difficult to adjust to that. It was 8 weeks ago, and I'm having this weird pain, like I can feel pain in my leg that's not there anymore. And it's super painful. I can't do anything about it, and it's really scary. I've noticed like some other pain just from, I'm too sensitive to have a new leg put on there yet. And I can tell just the way I have to move now is uncomfortable. I have this cruise planned with my daughter. It was really expensive to book to celebrate her graduation. I'm a single mom, so we're just, single income household. I really want to be able to go on this trip with her.
Yeah, for sure. I'm sorry to hear about all that.
Thank you.
Tell me a little bit more when you say like it's harder for you to like adjust around the house. Like, can you tell me a little bit more on that?
Sure. I have just started sleeping in the living room because it's such a pain to get up and down the stairs. Sorry, what else did you, what was that question again?
No, yeah, you're
Other
good.
things I'm struggling with?
Yeah, tell me, like you said, it was a little bit hard to like adjust to things like around the house a little, now.
Yeah.
Tell me a little bit more about that.
Yeah, so the stairs are hard, so just getting around the home, I find like the chores that I'd usually do, just standing on 2 feet, I can't do anymore. Like cleaning the kitchen, doing laundry, you can't do those things if you can't stand and have your hands free.
Right. That's for sure.
Yeah.
Because are you on crutches right now?
Yeah, right now I'm on crutches, which also hurt, but.
Yeah. Well, hopefully that can be one thing we work on too, is do some crutch training, so hopefully you won't have any pain walking around on crutches for the time being.
That would be great.
But going a little bit to, you said you were having pain kind of in your limb, but it's not there anymore?
Yes, it's the weirdest thing.
Because that's something that we call phantom limb pain, and especially in amputees, that's something that's very normal. And
Okay.
like, I've worked with a bunch of amputees, and it is extremely common in that population. I see it all the time.
Okay.
So you're definitely not alone when it comes to that.
Okay.
What would you say the pain is like, and then what would you say it's like on like a scale of 1 to 10?
Yeah, it often feels just like a really deep aching. I feel it mostly like around where my ankle should be, and it will like radiate out to my foot and up where my foot used to be, I also will just feel like weird tingling and kind of shooting down that leg, and it can get as bad as a 10 out of 10. I feel like just the fact that it's so weird makes it hurt more and more.
Right. Oh, for sure.
It's scary.
Yeah. Do you have any pain kind of above the kind of incision site?
Well, I do when I'm touching it,
Okay.
or when anything touches it near there, it's like
Right.
things that wouldn't normally hurt.
For sure.
Yeah, it's still really sensitive.
Okay. Do you have any pain that maybe has like moved up a little bit further, like into your knee
Yeah.
Okay.
Yeah.
Okay.
It's just like everything hurt.
Yeah, no, for sure. So, I think one thing that might be helpful is there's like a way that I like to think about it, and especially like phantom limb pain, if you're interested in hearing that.
Yeah,
So-
definitely.
It's think of it like, we have all of our nerves and they come from our brain and then go out to our entire body, right? And so even though, say we lose our leg below our knee and we lose all the nerves that even go down to our foot, right?
Mhm.
But think of it like each part of your brain is a different like puzzle piece. And so you have a bunch of sensation that comes in, let's say from my hand, that goes to a specific puzzle piece that's meant for my hand, that goes directly to my brain. And so like I've got one of these puzzle pieces for each of my hands, I've got one for each foot, I've got one for my face. And so if we lose our leg, that puzzle piece that is there for all of the sensory and motor input for that leg is still there, even though the nerves down here are gone.
Okay.
And so now we're not getting any sensory information coming up. So what your brain is doing to kind of figure everything out is it's sending a bunch of signals down there to be like, because it's like, what the heck is happening, right? And so like you can think about how like if we go and step on something sharp, you might bring it up and like rub it and give it that sensory input. And that's kind of what the brain is looking for right now.
Okay.
Where it doesn't really know what's happening, so it's just causing you to have pain.
That makes sense. Okay.
And so with that, we do have some therapy techniques that can definitely help decrease a lot of your pain and just help calm that system down if you're interested in that.
Yeah, absolutely. I need help.
Yeah, all
So
right.
whatever techniques you have.
Sounds good. So the first one that we would do would be laterality training. And so with this is step one. So with this, what we would do is we would take 25 cards and have them all oriented in one direction. And the goal of this is to have the patient be able to differentiate right from left, because it's pretty common in something like an amputee, where there's a lot of trauma associated with it, where some things like, even you can see it even in strokes, where like neglect can occur, where they just kind of don't acknowledge one side of the body. And it's really important for us to determine, okay, what in our body is the left leg, what in our body is the right leg, before we move on to something like mirror therapy or even explicit motor imagery, to be able to differentiate, okay, I'm thinking about moving my left foot right now, if our left foot is the one that's amputated, which can help prime us and get us ready to do mirror therapy. And so with this, we would be looking for about 85 to 90% accuracy on 20 to 25 trials, and having them do less than 2 seconds for each card. So saying this is the left hand, right hand, so on, pretty quick. And then with that, what I would do is I'd probably start with like the hand and have them just differentiate between that. Then what I might do is move down to a different body part, like maybe like the back or the feet, before moving into changing up the direction of where the card is oriented to make it a little bit trickier. And if the patient is still pretty good and is still accurate with that, then I would say that they've mastered that skill. So with that, we would move on to explicit motor imagery. And so with explicit motor imagery, this would be like, I would work with the patient and have them really, well, first I would say like, okay, like what do you think some movements could be that you could imagine yourself doing with that residual or with that amputated limb? And so whether, like in this case, it could be like bringing your toes up and down, or like curling your toes, or like moving from side to side. And then we would get into a circuit like that. And so if they would be able to complete that circuit with no increase in symptoms, then we would be able to move on. And once again, we move into something like, okay, what is like the least threatening thing you could do versus like the most threatening thing? Like, can you first like curl your toes as opposed to like imagine yourself like rolling your ankle around? And so once the patient has displayed those, then both of those, both completing the laterality and then the explicit motor imagery, then we would move on to mirror therapy. And so for mirror therapy, what we would essentially be doing, and I'll demonstrate this for you real quick,
Okay.
is with this, it's really important to especially have, let's say, both your feet completely bare. If you have any jewelry or anything like an ankle bracelet on, being able to take that off, because what we're doing is we're kind of tricking the brain a little bit. So to the point where I'll have you sit on here, and so your left leg is the one that's amputated, so we'll have the right leg up here, and I want you to sit so that you cannot see your left leg at all, and you can see kind of roughly where it would be in the mirror. And so once it's there, I want you to kind of get settled in and try out a little bit of movement, and it's almost like doing that explicit motor imagery alongside of it, and try and getting some of that movement at the same time. And so what this is doing is we're using our eyes to look at this movement that we're doing, and it helps trick the brain, being like, okay, I'm sending these motor signals down, and it's actually happening because I can see it. And so that way it helps settle that brain down and can reduce a lot of that pain.
Okay.
So with this, we might hang out, get yourself oriented, and then if you're feeling okay with it, then we might work a little bit towards like bringing your foot down and up, or like curling your toes or moving side to side. Does that sound okay?
Yeah.
Awesome. Let me get my sock back on here. All right. Get this mirror out of your way, and you can feel free to take a seat.
Okay.
Perfect. You're good. Awesome. And I'm going to put this mirror right here, and you can adjust that. I'm going to hang out here, and I'll hold it
Okay.
down here. And I want you to make sure that you can't see your left leg at all, even top.
Mm-hmm.
Okay. How are your symptoms right now?
They're okay, maybe like a 5 out of 10.
Okay. All right. So we'll hang out here for like a minute or two. I want you to get a little bit oriented.
Mm-hmm.
And so you can start. Is it a little bit weird?
It's so weird. It's so weird. I feel like I'm looking at both my legs right now, and yeah, wow, what a trip.
Now, when you're ready, what I'll have you do is I want you to think about moving both of your feet a little bit at the same time and doing the same movement. How does that feel?
It feels like I'm doing it with my left.
Okay.
I can feel like my left thigh doing the same thing.
Yeah. How would you rate your symptoms with this?
Not worse.
Good.
Yeah. Honestly, yeah, maybe better. It just feels good to see my leg doing what I'm trying to do.
Yeah, heck yeah. So we'll probably do this for another like minute or two.
Okay.
And especially like if this is reducing some of your symptoms, then we'll sit here for a little bit. Any other questions so far?
No, you've done a good job explaining everything.
Nice. All right. As we wrap up, what would you say like your symptoms are right now?
I feel like I've hit a 4
Okay.
out of 10.
Nice.
Yeah.
So look at that. We went down a little bit just by hanging out here for like 2 minutes.
Yeah. I think I could do this at home too
Yeah.
if I had a mirror.
One of the things, and it'd be good if I bring this back here.
Yeah.
All right. One of the things, at least for the instructions on how to do some of the mirror training, is being able to do it like once or twice a day. So if we do this in therapy, maybe, once or twice, maybe that being like the only time it's done that day, but otherwise, you can buy some good mirrors at home, or like at Target, and being able to use those, and just kind of sticking like once or twice a day for that, just for like 1 to 3 minutes each time.
Okay.
Nice. And just a little therapist little tidbit. One thing that you could do going forward with this, especially if they're having pretty good gains with this, is doing some sensitization of being able to introduce different sensations, especially if they're having some of that sensitization issues or having like a lot of pain with that, in order to help calm that down. Or especially if they're doing really well introducing other sensations to help calm that brain down a little bit further. Nice. All right, so what we can do is get your sock back on real quick, and then we can pull your chair up to this desk right here, and then I just want to go over something we call cup theory just a little bit.
Okay.
Or even, we can even stay right here too.
All right.
I'll do. So let me grab a pen.
Oh, okay.
Oh, you have a pen. Nice. Ooh. And then, since this is instructions, you don't have to draw. But, so one thing I want, so especially when it comes to like a lot of nervous system pain, one thing that I think would be good to know is especially your nervous system and your emotions are really connected. So like it's very common where I've seen like people have like nerve pain from like a disc or from an amputation, where if they're in a situation that's stressful, then your nervous system can pick up on all of those stress chemicals and then jack your pain up. And so that's one thing I wanted to address with this. We call it cup theory, where especially if you've been super stressed out about making all these changes at home, and like if worrying about, like you said earlier, being able to pay for the trip, being able to do things on the trip now, feeling pain from walking, you're sleeping on the couch now, all those things kind of add to your stress. And so just by doing that, they can jack your pain up. And so one of the things I wanted to talk about, being cup theory, is a good way for us to write all of that down and then kind of put it in a way where we can see some of the bigger stressors that you have, and then that allows us to look at some options on how to manage those so that your pain can go down.
Okay.
Is that something you'd be interested in?
Yeah, definitely.
Nice. So what I want you to do is I'll draw this cup out, and what I want you to do is write all of the things that kind of fill that cup,
Okay.
you know, and add a little bit of stress to your life.
Okay. Well, definitely the pain. Let's see. Like you said, sleeping on the couch is honestly stressful. My money situation is really stressful. It always has been as a single parent, but right now even more. Let's see. I've got my difficulty just moving around. Let's see. Should I be thinking of things like we said, like stairs are hard?
Yeah, like even just anything that kind of just comes up that you think has been kind of, or even just anything that you do during the day, like that takes up your time too. You know, it's
Okay.
another thing you have to do. Just kind of anything that kind of fills up time in your day as well.
Yeah, let's see. Work has been a nightmare.
Yeah.
They moved me to work at a restaurant. I'm an excellent server, but they moved me to they want me to train in an HR position now.
Right.
Anyway, so I haven't been happy at work, which takes up a lot of my day.
Yeah.
And of course, you know, my daughter's a teenager. She doesn't have the frontal lobe to really be considerate of what's going on for me. So I think just having to explain myself in relationships,
Yep.
explain what I'm going through is really demanding.
Yeah.
Yeah.
I think that's a good start.
Mm-hmm.
Out of kind of those, what would you say would be like the number one or two kind of things that take up the most space almost in that cup?
Like the most amount of energy.
Yeah.
Working is a huge amount of energy. It's also very frustrating. Worrying about money kind of goes with that. I don't make as much money now
Yeah.
in this new position they're pushing me into. And yeah, I would say work is like my biggest thing.
Okay.
And then worrying about money is part of it.
Right, for sure.
Doubles it.
Yeah. What do you think kind of in that cup or the things you highlighted would be some things that you could do to like change a little bit to make things a little bit easier?
It's a good question. I think if I could get back to sleeping in my bed in my bedroom, that would honestly be really helpful for me.
Yeah, well, I was gonna say, like, sleeping helps clear all those stress hormones, you know, and then you feel so much better and less stress when people get more sleep, you know.
Yeah.
And then sleep is so impactful with recovery. Or if you're sleeping on the couch, you're probably not getting as good even quality of sleep as you are in your bed, right?
Absolutely.
And so I think that would be something we could definitely work on in therapy. Do you live upstairs or?
Yeah, my bedroom's
Yeah.
on the second floor.
And I think that is definitely something we can work on about getting you up and up the stairs into bed and back downstairs and all that. Because I think that we make a huge impact on just everything.
Yeah, me too.
Nice. So another therapist little tidbit is that there is a book on the cup theory, a little workbook that you can give to your patients. It's about like 40 pages. And so that might be a good option if they think the cup theory would be a good thing to help kind of understand a little bit more and to better help kind of put into reality some of the things that are giving them a lot of stress and work on helping make those things smaller or making the cup bigger in order to just better support themselves and the condition that they're in. And so additionally with that, I think for The mechanism type of pain is neurologic. Some of the questions that I had for her in the beginning, I wanted to see if the pain was starting to be like nociplastic, where because we're 8 weeks out, and so the pain could move a little bit because it was a below-knee amputation. And I'm not necessarily surprised at all that there could be pain, neurologic pain associated with palpating the stump, but then if the pain started moving to the knee or started moving up further to the hip, kind of on the homunculus with cortical smudging, or to the other foot, or starts traveling to some other places, then it would start becoming more nociplastic. Additionally, some of the kind of social determinants of health that we were looking at, or that I was looking at, was that she's a single mom. She brought up a bunch of times that she had trouble with finances and being able to determine or have enough money to pay for this vacation that she wants to take her daughter on. And then additionally, there was a occupational flag about how they're moving her to a different position within her own job.